Hey everyone, this is Dr. David Midoff, physical therapist from Paso Manual Physical Therapy. And I just wanted to explain how pain works. A lot of people are kind of confused about how it's supposed to work and why you have it, why it doesn't go away, why does pain medication affect it, and are you doing the right things to make it better? Is doing physical therapy the best thing, or maybe massage or chiropractic or injections, medicine, all kinds of things that you can do for your pain. But on a very simple, basic level, let me just explain how pain works in the body. Now, of course, it travels through nerves. Nerves carry all the signals from every single sensation in our body up to the brain, and then your brain reads it as, hey, I'm hurting and you need to do something about it. Now, let's just say you bump your shin. You trip on a step and hit your shin. What's the first thing that you start to do? You grab your leg and you start to rub it, right? Well, there may be some actual damage, like maybe you ripped your skin a little bit, maybe there was some bleeding involved. You start to swell up in that area, and the pain nerves are screaming at your head, ouch, my shin hurts. Now those nerves, if you think of them like hoses, like a hollow tube, they're kind of like that, except instead of carrying water, they're carrying a pain signal, and it travels up your shin, up your leg, up your spine, into your head. Those nerves are the smallest in diameter in the body. They are truly the smallest nerve fibers in the body. And they also aren't covered up with this thing called myelin. It helps the signal to go faster. Now, every other nerve fiber is bigger and it's myelinated better. And so if you think of the other sensations you have in your body, you've got temperature, like cold and hot. You've got pressure, like light pressure, and then deep pressure. You've got something called proprioception. That's your ability to sense your body's position in space. So like that's how you can tell if you close your eyes and if your hand's open or closed, you know without having to look at your hand. And same thing with the rest of your body position. You could tell if your legs are crossed or what position your feet in, or your feet are in, or what position the rest of your body's in. There's nerves that carry that information up to your brain as well. Every other sensation in the body travels through a nerve that's bigger in diameter. The hose is bigger than pain nerves. So going back to our example, you bump your shin, you trip on a step, you hit your shin, you're bleeding a little bit, and your body's telling you pain, and reflexively what we like to do is rub it. I think of Family Guy, that iconic long drawn out moment where the main character trips and hits his shin and he's just sitting there rubbing and going and the thing is, rubbing it is not fixing it, right? It's not necessarily healing the tissues. Maybe you're stopping the bleeding, but you're still swelling, and so it's not fixing the tissues. So why do we do that? Here it is. The reason is, going back to the nerve fiber size, when you rub it, you set off the pressure nerves, and they're bigger. So the signal travels a lot faster up to the brain, and it's much louder because you have a larger nerve. And you actually drown out the signal from the small pain fibers. And it masks the pain for a little while so you can kind of get over it and get up and keep going, do whatever it is you have to do. Same analogy, if you bump your head, what do? You rub it. Of course, you're going to get a goose egg, a bump that develops and it's tender afterwards. Rubbing it isn't making it heal. It's just masking the symptoms temporarily so that you can proceed and keep going on. Now, those are some obviously clear examples, but what if you have back pain? What if you have neck pain or shoulder pain? You didn't necessarily hit yourself. It just kind of started happening throughout the day. And let's say the common thing that I see people for is they get pain in this area. They think that it's that achiness at the end of the day, knots, as we say. They're tired, maybe they have a desk job, and it starts to hurt. Well, it makes sense. Rub it out. Maybe you rub it yourself, or maybe you go get a massage, or maybe you take some pain medication. Maybe you stretch it. All those things are putting a different input into that area, and they're doing the same thing as like when you rub your shin. It's you're activating nerve fibers that are bigger than the pain fibers. You're activating the pressure fibers, the stretch fibers, the proprioception fibers, and you're not you're just drowning out the pain fiber sound, the pain fiber signal. So what's the solution here? What do you actually need to do? You need to make sure that you fix the original problem. So in this case, it could be several things. It could be joints in your neck, could be weakness in the muscles in the area, could be the way that you're moving. That's what needs to be addressed so that you're not running into this issue long term. But it's important to understand that stretching out all the time or getting a massage all the time, it'll make you feel better. Absolutely. If that's what you want, go for it. But it's not going to fix the problem long term. And that's what we're looking for, right? You don't want to have that pain at the end of the day, that shoulder pain or that back pain or knee pain or whatever it is. We need to address the motion or the weakness that's involved in getting you to that point. So that's it for today. I just wanted to explain the whole pain idea. It's something I say to patients all the time. I thought y'all could benefit from hearing it, from hearing that from me directly. Y'all have a great day, and God bless.